Let's talk of the drugs that have an impact on AMH. This study investigated whether common medications used in reproductive medicine for women's health change the AMH levels. AMH is often used for fertility planning, especially before IVF or major decisions made during freezing. If medicines can change the levels, the test could mislead both patients and their doctors. So this study looked at a meta-analysis combining data from 51 high-quality studies and over 4,000 women. It looked at several different medications or supplements frequently used in women of reproductive age: oral contraceptives, the pill, metformin, GnRH agonist, DHEA, vitamin D, clomiphene, and letrozole. And this is what they found. In women with a normal ovarian function, using oral contraceptives dropped AMH levels significantly. We do know that, sometimes more than 1 point within the first 3 months. And that's one of the reasons why we say have a gap of at least 3 months before you test it. After that, the effect lessened. Women with polycystic ovaries who took metformin also had a lower AMH, regardless of whether they were obese or not. Why? Because here the AMH is a challenge, and a high AMH prevents follicles from growing. So, a very different cause. Metformin reduces AMH and thus helps for successful ovulation. Treatment with GnRH agonist for endometriosis first pushed AMH slightly up at 1 month and then a few months later down. A complex pattern that tends to happen. Women who took DHEA or vitamin D, small mild increases AMH, though the changes were most seen in women without PCOS. Clomiphene, a common fertility drug, reduced AMS, especially in non-obese PCO patients, but letrozole had no effect. Again, why does that happen? Again, it's a treatment aspect. My general opinion is during stimulation, please do not test, because it just gives you a wrong result. If you do test while women are on these medications, you're not going to get a clear idea, and also you're going to give a very confusing picture. Often you would say come off the pill for at least 3 months. For women with diminished reserves, the role of DHEA is a big question mark. It may give short-lasting boost to AMH levels. So in short, if you're planning to do an AMH test, it's very important to see if the woman is on some medication, the pill most important, or is undergoing treatment.